My name is Dr. Patrick Newman. I am one of the chiropractors here at Align for Life, and I'm going to be taking this evening's presentation. And hopefully after tonight, you guys will have enough information to make more informed decisions on how to manage things like arthritis. Before we begin, I just want to thank each and every single one of you for being here. We have a saying in the clinic that success is always reserved for the action takers, and the secret to success is showing up, and that's exactly what you've done. So you can all just give yourselves a tap on the back and just say, I'm awesome. So by the end of this talk, my commitment to you is that you're going to know what arthritis is, you're going to know how it impacts the spine, and you're going to learn how we can help. Does that sound fair? Cool. Having attended many conferences all over the world, I find that I always get so much more out of the message if I know just that little bit more about the messenger. So if you've heard me speak tonight, just bear with me if you haven't. Is it all right if I just give you a little bit of information about who I am? Brilliant. So as you can tell from my accent, I do not come from the Isle of Man. I come from South Africa. I was born and raised in Johannesburg, and I completed my 6-year chiropractic degree there too. After completing my master's, I moved into private practice. So just fun fact, you cannot practice as a chiropractor unless you have a master's in South Africa, and it was the first country in the world to offer it as part of the degree. As I mentioned, once I qualified, I moved into a private setting in a small little suburb just outside of Johannesburg CBD, where I practiced for 3 years before my wife and I decided to move. Now, once I'm qualified, we, as chiropractors in South Africa, are trained on what's called the diversified technique, which is the most commonly used form of chiropractic care globally. While it's very powerful and get movement into the spine, I was getting a little bit fed up and irritated by the short-term relief I was getting with some of my clients. I felt that people were coming in with the same problems over and over again. And it was around this time my wife and I were kind of toying with the idea of leaving our home for both personal and professional reasons. You can appreciate being in the southern tip of Africa means you're pretty much in the middle of nowhere. So from a research point of view, in terms of all the work that's going into the chiropractic degree, we had very limited access. From a personal reason, you can appreciate that there's obviously a lot going on in South Africa. We were concerned about mainly the safety, and we decided that we didn't want to raise a family there. And so we'd started branching out and having a look and see where we could move. And it was around this time that our very close friends had moved to the island. And one of them had started care here at Align for Life with Dr. Thompson. And just out of passing asked, are you potentially looking at expanding? And he was like, well, I'm looking for both a chiro and a physio. And that works for me because my wife's a physio. So he reached out to us and he said, listen, guys, we've got the opportunity. Perhaps come have a look at the island, see what it has to offer. And if you like it, we can talk about you potentially starting to work here. So my wife and I decided, okay, we will come visit the island, but we're going to come visit at the worst time of the year. We said if we can survive the winter, we could probably survive any time. So we came to visit the island in January of 2019, and it was exactly as you'd expect. Completely rainy, dark, and very windy. And we still fell in love with the island. And within 6 months, we packed all of our stuff. I'd sold my practice. We shipped everything across. And I've ended up over here. Now, since arriving, I have started specializing in what we call CBP, which is a branch of chiropractic. It's also known as chiropractic biophysics. It's the most researched form of chiropractic in spinal rehabilitation. Out of all chiropractic techniques combined, it's one of the most researched forms of spinal rehabilitation out of all professions as well. So it's very evidence-based, which resonates really well with me. My wife and I have also since celebrated the birth of our little baby girl, and we've decided that we couldn't think of a better place than to raise a child than on the Isle of Man. And so we've decided that this is going to be our permanent home, and that's how I've ended up here in front of you this evening. Now, before we begin, I do have a few house rules, if that's okay. I find that education is always best learned when interactive. So throughout this evening's presentation, I'm going to be asking a couple of questions, and I'd just greatly appreciate it if you guys could interact with me. Does that sound fair? Brilliant. Okay, let's begin.
Could I just say I did mention when I booked it?
Yeah, that's fine. That's fine. I think you said 7:20,
yes,
hey? That's
yeah,
okay. So you just nip out when you can. Okay. No, not a problem. It's own. It's not a problem. Okay, so here's what we know, folks. Things like back pain, hip pain, foot pain, knee pain. These are all symptoms, okay? Pins, needles, numbness, tingling, these are symptoms. Who would like to describe what a symptom is to me? How would you best describe it?
Something you can feel and are aware of.
Okay. Sense. Okay, cool. So it's pretty much a communication, yeah? A communication between your brain and your body. What's your body telling you?
Something wrong.
Yes. Okay, that there's a problem, that there's some form of stress that it cannot adapt to, that you're moving away from health and that you need to address the situation, or you need to get out of the situation that's causing the problem. Now, would you say that that's a smart response, that your body creates symptoms? Absolutely. We know that the body's smart. And we call these symptoms body signals, okay? But really, they're just the tip of the iceberg. Okay, so here's the key. The way you respond and interpret these body signals is what makes the difference. Okay, so do you acknowledge that there's an issue? Do you tackle it head on and make a change? Or do you ignore it and pretend like nothing's going on? Tell yourself things that maybe it's just aches and pains. Maybe it's just something that'll disappear on its own. Or worse, do you potentially try to stifle out your symptoms using things like medication, which is great for pain relief and inflammation for the short term, but it really is just masking the issue. You're not actually addressing the underlying cause. Okay, so the way you think about your symptoms really drives your outcomes, and that's what makes all the difference. Because if you just treat the tip of the iceberg, you're ignoring the big problem, and you're letting what's ever happening getting so much worse. Okay. What we have over here is what we call our illness-wellness continuum. Okay, so when it comes to health, there's really two directions. You're either moving towards it, or you're moving away from it. It says a neutral point, but health is not neutral, okay? It's never static. You're either moving towards it or away from it. So we're going to start over here on the sign, symptom, and disability part. Okay, so what's a sign? How would you describe a sign to me?
Pain.
That's a symptom. Okay, so let's use something like, I'm going to use something like heart disease. Okay, so what would a symptom, or what would a sign of heart disease be? It's on the tip of your tongue.
Well, I was going to say breathlessness, but that's a symptom.
That's a symptom, okay. Tiredness, again, that's a symptom. Blood pressure. Blood pressure is a sign. So if you take your blood pressure and it's high, that's a sign. So a sign is some form of objective measurement, okay? What would a symptom of heart disease be? What's normally the first symptom of heart disease?
Breathlessness.
It's normally a heart attack for most people. Okay, so have you noticed though that symptoms develop after signs? Okay, I want you to keep that in the back of your mind. Okay, and then it can obviously result in disability. So again, you're looking at something like heart disease, obviously big problems, and then eventually death. Okay, now I know that was the extreme, but I just want you to bear in mind where I'm going with that. On the other side, we have moving towards wellness. So education is the best tool that you have at your disposal. The more you know about what's going on, the better informed you are about making decisions on how to manage it. Okay, so it starts with awareness, then education, then growth as you make your decisions. Okay, so symptoms tell you in which direction you're headed. So if you have symptoms, you know which way you're going. Okay, so this evening's presentation is all on arthritis. Okay, so primarily on arthritis of the spine, but arthritis is very much an umbrella term. So who here would like to define arthritis for me? What is arthritis?
Inflammation of the joints.
Okay, to an extent, you're on the right path. Okay. Anyone else? Okay. So, while the word arthritis is used by clinicians to specifically mean inflammation of the joints, it's used in public health to refer more generally to more than 100 different conditions. Arthritis is a very broad term. All right, so it comes in many shapes and forms. Who here would like to yell out a type of arthritis that they know of? Rheumatoid arthritis. What else? Oh, before I go there.
Juvenile arthritis.
Juvenile arthritis. Okay, well, I kind of gave it away, so let's just go on here. Okay, so let's have a look at this little family tree that I've put together for you. Okay, so we have osteoarthritis. This is the most commonly known form of arthritis. Okay, it is degenerative, and this is the one that we're going to talk primarily about tonight. We then have our inflammatory arthritis, okay, which is further divided up into crystal-induced arthritis, which are things like gouts, and spondyloarthropathies. How's that for a word? Okay, spondyloarthropathies are divided up into what we call seropositive and seronegative. So a seropositive arthropathy would be a rheumatoid arthritis because it's got the presence of rheumatoid factor. So they'll normally do a blood test to help diagnose it, and if you have the presence of rheumatoid factor, you have rheumatoid arthritis. Your seronegative arthropathies have no rheumatoid factor in it. They are also inflammatory though. Okay, they're divided up into ankylosing spondylitis. Has anyone heard of that? Yeah. Psoriatic arthritis, reactive arthritis, and enteropathic arthritis. So your ankylosing spondylitis primarily involves the spine. Okay, it's most commonly seen in males between the age of 15 and 35. It eventually, or it can result in the fusion of your sacroiliac joints, which is the junction between your ilium, which forms part of your pelvis, and your sacrum, okay, which is the base of the spine. Psoriatic arthritis is commonly associated with psoriasis. Has everyone heard of psoriasis? The scaly silver skin that can form. Just a disclaimer, if you have psoriasis, that doesn't mean you will develop psoriatic arthritis, okay. You then have reactive arthritis. This is usually as a result of some form of infection. It will normally impact things like your urethra, as well as your eyes, as well as the spine. Enteropathic arthritis, this is usually as a result of some form of digestive issue, like ulcerative colitis or Crohn's disease. Okay, they commonly occur with that. So your inflammatory arthritis often involve other systemic conditions, so they can involve organs. It's generally autoimmune, exacerbated by a stress response, which we're going to talk about tonight. We then have our crystal-induced arthritis. So everyone's heard of gout, right? Okay. Have you ever heard of pseudo-gout? Okay. So gout is the formation, is a result of urate crystals forming, whereas pseudo-gout is the result of calcium crystals forming in your joints. Okay. We then have septic arthritis. Okay. This is our only exception to this evening's presentation. This is life-threatening. Okay. It's usually obviously as a result of some form of infection, whether that be from a fall or somewhere, you know. You must go to the emergency department for that. That is life-threatening, please. Okay. We then have juvenile arthritis, which was previously known as juvenile rheumatoid arthritis, which is divided up into those three. Again, this is also autoimmune and is generally exacerbated by a stress response. A lot more complicated than what most people originally think when it comes to arthritis. Eh? So there's a lot going on. Our osteoarthritis, which is our primary focus this evening, is divided up into primary and secondary, which we're going to touch on now. Okay, so let's look at degenerative arthritis or primary osteoarthritis, also known as degenerative disc or degenerative joint disease. Okay, so it's got a couple of different names. All right, so with your osteoarthritis, basically what happens is the protective cartilage that lines the joint starts to wear away or break down over time. The main areas are obviously your weight-bearing structures. Okay, your spine, your hips, your knees. Hands will also be involved. Why? Why do you think your hands are involved?
Muscle joints, maybe.
Okay, you use your hands a lot, yeah? Okay, so naturally over time what's going to happen? It's going to wear away, naturally. Okay, so this is basically just like a cross-section between a normal and an arthritic joint. Okay, so majority of the joints in your spine are what we call synovial joints. Okay, so a joint is defined as two articulating surfaces. You have a bone on either side. A synovial joint has a synovial membrane, and inside is synovial fluid, and then it's lined by the cartilage. Okay, what happens with osteoarthritis is that cartilage starts to wear away. As it wears away, the gap or the distance between the two bones becomes more narrowed, and eventually, if broken down far enough, it'll start rubbing against one another. Okay. As a result, what will start to happen is you can get bone spur formation, okay, where your body actually starts depositing new bone into the area as a response, as it tries to heal. Okay. Now, sometimes, or most of the time, it can be asymptomatic, so you won't experience any kind of symptoms. If they grow big enough, they can cause things like compression, okay, where they can actually start pinching your nerves. That's generally the most common symptom with a bone spur with degeneration. Okay, what I'd like to do with you though is, a lot of people tend to confuse rheumatoid arthritis with osteoarthritis or degeneration. So I'm just going to give you a comparison between the two. You can apply the same kind of bullet points to any of the other inflammatory arthritis as well. So let's have a look. So rheumatoid arthritis is an inflammatory condition. Osteoarthritis is a degenerative condition. Okay, so both in the family of arthritis, both very different. Rheumatoid arthritis generally has symmetric involvement, so what will happen on the one side of the body will happen on the opposite. Okay, so you'll find if it starts in one finger on this side, it'll start on the other finger as well. Okay, whereas osteoarthritis is generally asymmetric, and it will usually involve your large bones first. Again, why do you think that's the case?
Constant use.
Exactly. Okay, remember, it's a degenerative condition. Okay. Rheumatoid arthritis is generally polyarticular, so it involves many joints, whereas osteoarthritis is generally monoarticular, so only involving one joint. RA has general visceral involvement too, so your viscera are obviously your organs. Okay, so rheumatoid arthritis, for example, can affect things like or can impact your heart or your lungs, and this is the same with your other inflammatory arthritis as well. As I said, enteropathic involves the gut, reactive involves the bladder and the urethra, psoriatic arthritis obviously involves the skin. Okay. However, I do need you to be aware that with time, a stress response will have an indirect impact on organ function, which we're going to talk about just now too. Okay, with rheumatoid arthritis, you have erosion of adjacent bony surfaces. With osteoarthritis, you get sclerosis. So when you take an X-ray, if there's degeneration, you get almost like a white lining along the on either end of the joint. So if you get that white appearance, that's what we call sclerosis. And osteophyte formation, which as we've discussed is bone spurs. Stiffness is the big telltale. Okay, so arthritis is generally associated with morning stiffness. Okay, with rheumatoid arthritis, it'll be less than an hour. With degenerative arthritis, it's usually more than an hour. As you start getting mobile again, it'll start to decrease in terms of pain. You might start to get a little bit more stiff towards the end of the evening with this one too, as you start to use your joints more throughout the day. Okay, does anyone have any questions with that? Okay. So here's just again another cross-section giving you the differences between normal osteoarthritis and rheumatoid arthritis. So again, as your cartilage starts to deteriorate, your body's going to try heal itself, and as a result it starts to develop bone spurs, which we've talked about. So you can see it's slightly different with rheumatoid arthritis. What happens is, as the condition progresses, the synovium, which is found inside that area, produces synovial fluid. It swells and thickens, okay, and it produces what we call a pannus, which is kind of like a, I'd say, gloopy thing of like bits and bobs throughout the body, which becomes acidic. And what it starts to do is, at the top here, you can see how it starts to erode the bone. Okay, so you can see very different presentation between the two completely separate diseases, obviously forming within the same family. Okay, raise your hands if you think that life nowadays is unnecessarily stressful. Everyone should be putting their hands up because we know it's true. How many of you would agree that life is getting more stressful? Okay, now you need to remember that stress comes in different shapes and sizes. It's not just emotional stresses. We also get physical stresses, so Robbie, on your point 100%, overuse. And we get chemical stresses. Okay, so also known as toxins, traumas, and thoughts. Okay, so we're going to obviously start with the most obvious one, your physical stresses. Okay, so let's look at our macro traumas. These would be things like trips or falls or car crashes. Now, we obviously know that this is going to damage the spine and have an impact on how your body heals. What most people don't realize is this sets you up for post-traumatic arthritis. This is secondary osteoarthritis. And what happens is it causes wearing down of the joint, which has been involved within an injury. The problem is it only surfaces around 10, 15, 20 years after the injury. Symptoms again include things like joint pain, swelling, accumulation of fluid, reduced mobility. So it's most likely again going to be impacting your weight-bearing structures, but it can impact any area of the spine that has had an injury. Again, think of whiplash. Okay, this is the big one, and this one that we commonly see in practice. Most people have a whiplash injury 10, 15, 20 years down the line, severely arthritic neck because of the impact of the car crash. Okay, let's zoom in though on the micro traumas. Everyone's heard the saying, don't sweat the small stuff, yeah? Okay, that doesn't really apply to bullets, and it definitely doesn't apply to something like this. Okay, so micro traumas are the stresses we subject our bodies to on a daily basis. So I'll use an office worker, for example. They sit down at a desk, generally 8 hours a day in, day out for many, many years. As human beings, we're designed to be bipedal, upright on our feet. Sitting down results in abnormal loading. If you were a construction worker, obviously very manual, repetitive bending, twisting, handling. Okay. So you can appreciate over time, if you're doing this all day, every day, year in, year out, your spine is going to start wearing over time. Okay. Now, what about thoughts, emotional stresses? How on earth would that cause the spine to break down? Well, it's simply because of muscle involvement. When your body is stressed, what happens to your muscles?
Tightens.
They tighten. And what do muscles attach to?
Ligaments and, whatever.
Indirectly into your spine. Okay, or any bone. Okay, so if they're tight all the time, you can imagine that's going to have an impact on the positioning of the bone or the joint. Okay, what about chemicals? Smoking. Smoking is one of the biggest causes of arthritic change, causes the spine to break down. Heavy metals, pesticides, unfortunately very difficult to get away from nowadays because they're in everything. Okay, but subjecting our bodies to those kind of toxins year after year can have an impact in the breakdown of your spine. So, the 3 T's, toxins, traumas, and thoughts, result in what chiropractors refer to as the subluxation complex, which I'm going to go over now. Okay, so you'll have some form of physical stress, emotional stress through tight muscles, or chemical stress, which over time results in joint misalignment. Okay, now your joints or your spine is unable to move the way that they're supposed to. Your body's going to try to protect itself. So what's its only line of defense? Soft tissue. Soft tissue is going to get involved. You can get soft tissue damage. That's going to result in inflammation. So while this is a degenerative condition, there is an inflammatory component to it. Okay, what is inflammation? Swelling. Okay, so if you've got swelling in your discs or your joints or the ligaments around that area, what do you think that can do to your nerves? Well, it kind of gives it away. Okay, it's going to irritate them. Okay. You're going to get, or you're going to lose imbibition. Has anyone ever heard of that word before? Okay, so your discs basically resorb water over time. Okay, so when you're sleeping at night lying on your side, your disc resorbs all the water that is pushed out throughout the day, because when you're standing up and walking around, you've got weight pushing down onto the joint, okay, or the disc. So you can imagine over time what happens is it bulges out, pushes the water, but as you lie down and take pressure off of the spine, it resorbs it back. But as the spine starts to break down, your body loses that ability. So what do you think is going to happen to your disc height? It's going to narrow, yeah. Okay, this all in turn results in joint fixation and degeneration, which over time results in arthritis and disc pathology. Okay, and in turn results in elevated stress hormones. So now we're coming to your question, it's coming. Okay, so I'm just going to go over the different stages of the subluxation complex. Okay, so again, most people just associate arthritis with the bone spurs. Okay, but it starts a lot earlier than that. All right, so let's just talk about a normal healthy spine from the side first. Okay, so the little squares that you're seeing there are obviously your vertebra. Little blue spaces in between are your discs or your cushions. Now they should be thick and even throughout. Okay, and obviously the lower you go in the spine, the thicker they should become. Why?
Bearing more weight.
Okay, spot on. More weight. Okay. These little holes that you see over here are what we call your intervertebral foramen. They are where your nerve roots exit. Okay. You've got little wings on either side, and then you have the tails over here. So they just serve for the attachment of muscles through ligaments, through tendons, and then you have ligaments that hold the spine in place. Okay, so with phase 1, what happens is your body loses its natural curve. So your body should have a nice S-shaped curve to it. Okay, a lordosis in the neck and the lower back, and a kyphosis or an outward curve in the mid-back. Okay, so what happens with phase 1? Your body moves out of its normal alignment. As a result, you're going to lose your curve. Okay, you're now going to be subjecting your body to abnormal loading. Okay, so I want you to think or envision that I've got a bowling ball in my hand, holding it like that. It'll be heavy, but if I stick it out, what do you think will happen? It's going to pull me down. It's going to get heavier. Okay, exactly the same thing happens in the spine. So research shows for every 10 mils you move forwards or backwards, you actually increase the load on the spine by 10%. Just you sitting here right now, you've increased your disc load by 50%. So you can imagine starting to add some kind of postural problems in there really increases the load, which you can imagine over time is going to result in breakdown. Because the spine is no longer in the right position, your joints aren't able to open and close the way that they're supposed to. So your mobility is going to become limited. Okay? And you're going to get narrowing of the disc spaces. Again, remember your discs are relatively soft and squishy in nature. Think of them like a marshmallow. So if you have a bone, a marshmallow and a bone, and you push on either side, what's going to happen to the disc? It's going to bulge out. Okay. What do you think the symptom is in this phase? It's usually nothing. Okay, so maybe just a little bit of fatigue as your body tries to compensate for the abnormal loading. Same with phase 2. Okay, so what happens is you get further loss of curve, and this starts to become associated with postural distortions. And then again, your mobility is further reduced. When it comes to phase 3, now you're starting to get structural changes in the joints and the bones. Okay, so what happens is you get roughening of your joint surfaces and you get the formation of bone spurs. So if you have a look at the disc height, you can see that's starting to narrow. If you have a look at the hole where the nerves are exiting, you can see that's starting to narrow. So you're starting to develop more of a structural problem now. Okay, you've got less room for the spinal cord and the nerve roots to exit, which again is going to make you more susceptible to experiencing symptoms. And I use symptom and not pain, which I'm going to touch on why now. Okay. With stage 4, this is severe bone remodeling. So this is generally the end stages of osteoarthritis. This is when the spine, or any joint for that matter, has broken down to the point where you're going to get irreversible joint fusion and permanent loss of motion. Okay. It can progress further. That obviously is not within my scope. That's generally where replacements come into play. The problem is you can't really replace a spinal vertebra, which we're going to touch on just now. So does anyone have any questions with regards to that? Okay, now I want you to remember that arthritis is also associated with your discs, degenerative disc disease. So when we look at the disc, I thought I would just share with you how a disc degenerates on an MRI over time. So yeah, you can see a normal healthy disc, nice and thick. You can obviously see it's starting to thin. There it's starting to bulge out. Again, abnormal loading, you can see how thin it is over there compared to the front. And over here, you can see that that disc is very flat. Okay. Now, the reason why your disc starts to bulge out is because of its anatomy. Okay, so your disc is divided up into 2 components. You have your nucleus, which is soft and squishy, and then you have your outer section that we call the annulus, which is made up of collagen fibers. Okay. What happens is as your spine is subject to abnormal loading, the outer collagen fibers start to fray. So you start to get little micro tears. Now the problem with this is your disc only has a blood supply on the outer portion of it. Okay, there's no blood supply in the inner portion. All right, so you can appreciate if you start getting tears towards the nucleus, how is your body supposed to repair? It can't. Okay. Now, because you've got weakness in the collagen, the collagen fibers on the outside, what starts to happen is that inner jelly center starts to bulge out. Okay, so you start to get herniation, then protrusion, and if severe enough, what will happen is it can actually break and you can get what's called sequestration, which again requires you to go to the hospital. So this is more commonly known as a slip disc. Okay, this whole process. So it doesn't matter what phase you're in, it's a slip disc. It's an incorrect term to use because you can't actually slip a disc. It's made up of very strong fibers. That's why a bulge or a herniation or a protrusion is a better term to use. Okay, so degeneration of the discs predisposes you to disc herniation. A herniation can happen as close to phase 1 or can happen at around phase 1. And again, it's just because you've got loss of curve, so abnormal forces pushing down. Okay, so generally when we talk about nerves, most people associate the nerves with pain. And that is true. Your nervous system is responsible for what you feel. Okay, but it only forms the smallest component of the nervous system. So your nervous system is divided up into motor control, which is obviously all your movements and your posture. You have your autonomic nervous system, which is all your organs. So again, moving more towards blood pressure now. And then your sensory component, which is the smallest. So it only forms 10% of the nervous system. The other 90% is divided up into autonomic control and motor control. Okay, so you need to appreciate that the primary function of the nervous system is to do what?
Control.
Okay, to control. It controls everything. It's the most important system in your body. It regulates every other system. Okay, its primary job is to keep you alive. Being in pain requires a lot of energy. So now it needs to focus on something else other than keeping you alive. Okay, so your body's going to do everything in its power to try to compensate to ensure that you're not in pain. Now, this happens with a lot of things. Okay, so let's again look at heart disease. We discussed it earlier. The first symptom is usually a heart attack. Now, do you think someone feels their arteries clogging up? No. And do you think heart disease happens overnight? No, it takes time. Okay, what about something more sinister? Let's look at cancer. How many of you maybe know of someone who went in for a routine check, came out diagnosed with stage 4 cancer, maybe within a year or two they've passed away? Again, it's not something that happens overnight. It takes time. It's a late symptom. Okay, this is why you cannot trust your health on the way you look and you feel. Okay, it's exactly the same. All right, so the most common symptom of a subluxation is no symptom at all. Okay, so when it does progress and you move further on along the path of that complex, it can have an impact on the rest of the body. So when you're looking at degenerative arthritis, the symptoms experienced directly correlate to the level of dysfunction. Okay, so let's just say you have arthritis at L5, that will determine what type of symptom you'll have. Okay, so if you have the sensory component being impacted, you're going to experience pain. You might develop sciatica. Okay, if you have the motor component, you might have postural problems. If you have the autonomic component, you might start to develop things like bowel issues. Why? Because where did the nerves that supply the bowel come from? From the lower back. Okay, so again, it just depends on what part of the nerve is being impacted, how much of the nerve is being impacted, and that will dictate what type of symptom you have. Okay, with your spondyloarthropathies and your juvenile arthritis, this is an autoimmune condition. Okay, so does anyone know what an autoimmune condition is?
It's an inflammatory thing, isn't it?
Okay, so basically your body starts to attack itself. Okay, so your immune system just goes haywire and it starts to attack itself. So the autonomic nervous system cannot regulate itself due to interference, and this results in a stress response. Gout, same thing, can be attributed to some form of interference resulting in adaptive physiology. So long-standing dysfunction leads to a stress response. Okay, so I want you just to think, how will your body respond to stress? So I'm going to give you an analogy over here. You all come back to South Africa with me and we all go on a safari. Okay, but we go walk about in the bush. Okay, we come across these guys. How are you going to respond? Okay, there we go. Okay, so you're going to go into stress. Yeah, fight and flight. You're going to either try run away or you're going to try fight those lions. You're going to lose either way. Okay, but your body is going to respond stressfully. So you just got to understand your body can't differentiate between actual threats and perceived threats. It just knows it's stressed and it's going to respond the same way. So let me show you how it responds to stress. So you have a stress response. So when you're stressed, what happens to your blood pressure? Okay, so if you're stressed all the time, guess what happens to your blood pressure?
High.
Stays up. Okay, what is that going to predispose you to? High blood pressure. What about heart rate? What do you think is going to happen to your heart rate? It's going to go up. What about muscle tone? What's going to happen there? Exactly, you're going to tense. What about digestion? Who here thinks that digestion is a priority when your body's stressed? Okay, I'm glad we all think the same way. Your body's not going to prioritize digesting food. It's not interested in that. What about reproduction? Do you think reproduction is a priority when you're stressed? No. What about your serotonin levels? Are they going to go up or down? They're going to go down. Do you think you're going to be feeling good if your body's stressed? No. What about your sensory system? Is that going to go up or down? Up. Your body needs to make you more aware of your surroundings. Okay, so sensation throughout the body is going to increase. You're going to be more aware of what you feel. Obviously, fear and anxiety are going to go up. What about insulin sensitivity? What do you think is going to happen there? Okay, blood sugar is going to go up. Cholesterol, okay, so you get the good and bad. One's going to go up, the other's going to go down. Clotting factors, what do you think is going to happen with your clotting factors? Up or down if you're stressed? Up, yeah, okay, because your body is going to get you ready to heal, yeah, so clotting helps with healing. What about your immune response? Do you think that's going to go up or down? Down. Absolutely. Do you think your immune system is a priority when you're running away from a lion? No. Okay, this in turn results in adaptive physiology. And what does this predispose you to? Well, I thought I would find a very old study just to show you how long this information has been readily available to the public. These are the 4 most common comorbidities associated with people who have arthritis. The big one is heart disease. Okay, so 1 in 4 adults with osteoarthritis will develop heart disease. 1 in 5 will develop chronic respiratory issues. 1 in 6 diabetes. 1 in 8 stroke. Okay, I've just explained to you why. Just before we go any further, I'm not bashing drugs or surgery in any way, shape or form. There is a time and a place. There is. Okay. But I need you to be aware that they can cause issues. This was a recent study that I read just the other day, found in Rheumatology, which is a journal literally for arthritis, that shows that things like NSAIDs, non-steroidal anti-inflammatories, like aspirin, ibuprofen, naproxen, can inhibit collagen matrix synthesis, okay, which accelerates in its destruction. Remember, your disc is formed by collagen. It's going to break it down over time. Also, taking the painkiller, is that managing the symptom or treating the problem? Exactly. Do you have arthritis because of lack of medication? Of course not. Okay. Physical therapies. So you're talking about physiotherapy. If you've had a replacement, absolutely fantastic. Those are the people you have to see immediately. Okay. When it comes to managing the condition before it gets to that point, from a functional point of view, great. They're going to help with soft tissue. Okay. If it's a structural problem, though, they're not going to be doing that much. Okay. Generally, a combination therapy works best. Okay. But again, these are the guys you want to go to after you've had a replacement. Steroid injections. So when the pain gets severe enough, most people go for cortisone. Okay. Cortisone has its own issues too, especially if you're using it long term. So again, this information is readily available. You can look at anywhere online. Another new study found that prolonged use can result in cartilage breakdown. Okay, but most people aren't aware that it also makes you susceptible to osteoporosis, which is brittle bone. Okay, so you need to be careful with what you're putting in your body. Again, I'm not bashing drugs or surgery. There is a time and a place, but it's not a long-term solution. Okay, pain management, again, tends to get a little bit more desperate. Surgery should always be a last resort, always. Again, when you're looking at your weight-bearing structures like your hips and your knees, yes, there comes a time where you might have to replace them. Problem is you can't replace your spine, can you? Okay, so what are you going to do to manage it? This is the question. Okay, so there is a better way. So I'm going to just talk about some supplements that you can start implementing at home to help. Okay, so let's start up at the top. We've got glucosamine and chondroitin. So these are the 2 most used supplements for arthritis. Okay, so they are components found in joint cartilage, and they protect cells called chondrocytes, which maintain their structure. Omega-3 fatty acids, okay, so they have immunomodulatory properties, and they act as precursors for lipid mediators of inflammation. So they help control and regulate inflammation. Where's your best source of omega-3? Fish, yeah, okay. Right, so the problem with farmed fish, not enough omega-3. The problem with wild fish, depending on where it is in the food chain, is the mercury buildup. Okay, so when it comes to eating fish, we normally say try limit it to around 3 servings a week. Obviously, the higher it is up in the food chain, so like things like tuna, don't overconsume. So your best source is to supplement it with an omega-3 fatty acid. When you buy your omega-3 fatty acid, just make sure that the bottle says molecularly distilled or mercury-free. Then you know it's clean. It shouldn't smell or taste like fish. If it does, throw it away. Okay, SAMe. So this is, excuse my pronunciation, S-adenosyl methionine, which is a natural component that's found in the body. Okay, so in studies, it's been shown to be as good at relieving pain as NSAIDs like ibuprofen or celecoxib without the side effects. Okay, your best source is things like egg whites, wild-caught fish, oats, and sesame seeds. Curcumin. This is what really gives the turmeric that yellow hue. Okay, again, also very powerful natural anti-inflammatory. Okay, so it helps promote enzymes such as COX-2, or it's been shown, to help regulate inflammation. Okay, blocking the same inflammation-producing enzyme that COX-2 inhibitor blocks. And then your vitamins, vitamin D and vitamin K. Where's your best source of vitamin D? The sun. What's the problem living on the Isle of Man? Yeah, not much. Okay, so everyone in this room should be on a vitamin D3 supplement. Everyone. Okay, even when the sun is shining in winter, we just do not get enough sunlight. Vitamin D is important for calcium absorption, which obviously keeps your bones nice and strong. It needs to have potassium in it. Okay, vitamin K helps ensure that the vitamin D is absorbed into the body and not stored in the organs. Okay, so they can be very useful, right? In combination. Do you want to take a photo? That is what you do. Oh, okay. All right, the only problem with the supplement market, unfortunately, folks, is it isn't regulated. So there is a lot of rubbish out there. So if you are supplementing, please do your research. So just take the time and ensure that what you're buying is well documented. It tells you everything that's in there. If you are ever unsure, we have tried to source the best product that we can. You do not have to buy from us, but if you're unsure, please pop in and just compare whatever you have to what we have. Okay. So what you can do at home, manage your weight. Obviously, the more weight you put on, the more load you're pushing down onto your spine. Well, guess what? It's going to make you more susceptible to arthritic change. You need to get exercise. Everyone should be doing some form of exercise. Now, that doesn't mean going to the gym. I'm not expecting you to become weightlifters. Okay? The easiest, cheapest form of exercise is what? Walking. Everyone can walk. Okay? So get up and go for a walk around the block. You need around 20 to 30 minutes of walking a day. Okay? Just something to elevate the heart rate up. Okay, use hot and cold therapy. Quick disclaimer, if you have an inflammatory arthritis, do not use heat. It will make it worse. Okay. So normal degenerative arthritis, osteoarthritis responds really well to heat. Okay. Heat helps with the extensibility of the tissue, so it'll be able to contract and relax a lot easier. You'll be able to move a bit better. It also has obviously analgesic properties, so it'll make you feel better, and it increases blood flow into the area. Okay, to help ensure that the structures around whatever joint is degenerated is getting sufficient oxygen and nutrients. Okay, just with regards to heat and cold therapies, try not to put them directly on your skin. Okay, especially the cold, you can get ice burns, so just make sure you're using some form of oil or some kind of material just to prevent that. The last thing you want is a stiff, achy joint and an ice burn. I don't think that'll be too much fun. Diet is huge. Okay, so a diet that's obviously rich in things like fruits, vegetables, and whole foods can help boost your immune system, boost your overall health. Okay, a plant-based diet provides antioxidants, which can help reduce inflammation by eliminating free radicals. So these are basically negatively charged molecules that readily want to attach to other molecules and break them down over time. Okay, you don't have to become a vegan. You can just start implementing some plant-based meals into your diet.
Wheat and dairy, I've heard too good for...
No, not good at all. So a lot of people think, okay, dairy is great because it's got a lot of calcium. It does, but your body just can't absorb it properly. What's the problem with dairy? It's pasteurized. Okay, Okay, now there's a reason why it needs to be pasteurized, but the problem is you're superheating it, so it denatures the proteins. Your body can't absorb it. Okay, it's also like builds up a lot of mucus, so you'll be surprised if you cut dairy out, how your nose will clear up. It's quite amazing. What was the other one you asked there, Robbie?
Wheat.
Wheat, yeah. So again, because of the grains, they've changed over time. They're no longer long grains, they're more short grain. Again, your body just can't absorb it properly. Leaky gut's a big issue nowadays. Neil does a wonderful digestive talk on all of that, talking about wheat and dairy and how it can impact the spine. So keep an eye out for that one. You want to make sure that you're trying to avoid excessive amounts of red meat. So everyone knows that red meat can cause gout, yes? Okay. But you also need to understand that if you have an imbalance between good and bad gut bacteria, it's going to release inflammatory mediators. Having a diet rich in red meat, unfortunately, releases inflammatory mediators. So if you are struggling with a lot of pain, just cut down on the red meat a little bit. Again, you obviously want to avoid any kind of refined carbohydrates or sugars. Okay, so if it's white and it tastes nice, get rid of it. Okay. Now, say again? Oh, again, fantastic. Another great question. So yes, we do recommend that everyone take some form of probiotic. It's important to get that balance between your good and bad gut bacteria. Again, if you have good balance, your bad gut bacteria won't be releasing inflammatory mediators, so it'll help regulate pain. It's a great question, yeah. So everyone should be on some form of probiotic. You're looking for one with at least 5 different strains. So if you think of your gut like a flower garden, you want many different types of flowers, not one, otherwise it's pretty boring. So things like acidophilus on its own is not good enough. And you should have at least 1 billion per capsule. It should be dairy-free, okay? So your supplement should also be generally whole food, so ground up like veg, okay?
So brown instead of white bread then.
Well, bread in general is not really good for you. So in fact,
You were having it.
to be honest with you, there's not much of a difference. Okay, I know everyone says that brown bread is good, but no. Bread is just as bad as any bread. Okay, so yeah, eat the white bread if you want. It makes no difference. But when you're looking at things like rye bread and stuff like that, that's slightly different. But between white and brown, I wouldn't worry too much. Okay, so when it comes to addressing the cause, there are really 3 things that you need to be focusing on. 1, you need to break bad habits. We know if osteoarthritis is degenerative, and let's just say it's a result of poor posture, as an example. If you know you're slouching, guess what you need to stop doing? Slouching. Okay. So if you know that you're doing something in life that is having an impact or forming some form of repetitive strain, just be more conscious of it and break those habits. Okay. You need to add specific exercise. You just have to. It's like brushing your teeth. You have to do it. Okay. Again, just to ensure that your spine remains nice and healthy and mobile. Chiropractic adjustments. So only chiropractors are trained to identify subluxations and remove them safely. So we use an adjustment, which is a very gentle technique delivered to a dysfunctional joint to encourage as much mobility as we can in that area. So I'm actually going to show you how an adjustment works. Okay, so when your joint becomes stiff and immobile, it starts to form adhesions. Okay, and this is going to prevent even further movement from occurring. So when we adjust you, we cause the joint space to open up rapidly. Now, I don't know if you've seen any videos, most people associate chiropractors with big manual adjustments. It doesn't have to be, okay? Any movement into that spine will help break down that adhesion. Okay, with the adhesions no longer present, the joint is able to move and function the way it's supposed to. From a sensory point of view, the chiropractor provides a sudden stretch to the muscle around the spine, and that rapid stretch results or restores normal muscle control, and the brain and the body are able to communicate a lot better. So this is from a short-term point of view. So this is how an adjustment helps obviously regulate pain and inflammation. You're getting movement into the spine, it takes pressure off of the nerve. Okay. Long-term, it has an impact on our prefrontal cortex. Has anyone ever heard of this? Prefrontal cortex. Okay. So the prefrontal cortex controls and regulates 5 very important things. The first is pain and inflammation. This is obviously how we're able to get people out of pain. Okay, it also controls and regulates the autonomic nervous system, which remember is all your organs. Okay, so with a chiropractic adjustment, it pulls the body out of fight and flight response into rest and digest. And that's because it has an impact on your endocrine system. So studies show that when you adjust the spine, your cortisol levels decrease. What is cortisol? Stress hormone. Okay, so I just showed you earlier on how having a spine that doesn't move properly and is not functioning properly results in a stress response, which means your body starts secreting more cortisol. Okay, it also controls and regulates the immune system. What is an autoimmune condition? Well, it's your immune system going haywire. Yeah, so it brings balance into that. And it impacts higher cognitive function. So most people generally associate that with memory, concentration, and focus. Okay, so again, this is more of a long-term impact of the adjustment. So it helps with pain and obviously gets the body functioning better by restoring communication between the brain and the body. So what I thought I'd share with you guys is just some success stories in terms of people who have come into the clinic with pain and arthritis, and how we've able to reposition the spine, take load off of their joints, and obviously help manage their problem and help prevent their condition from progressing any further. So what we have over here on the left, can everyone see that, by the way, is a gentleman who came in with back pain. You can see that he's got degenerative change between L5 and S1. That disc is very narrowed compared to the rest of the spine. Okay, now, as I said to you, his spine has already started to degenerate, so there's nothing I can do to change that, but we can prevent it from getting worse. So what we'd expect to see with a spine from the side and the lower back is that you should have increased curve at the bottom, and it should start flattening up as you get to the top. You can see what's happened with this gentleman is his spine has shifted backwards. The red line is where he should be. The red line is where he is, sorry. The green line is where he should be. So he's translated 16 mils backwards. I told you for every 10 mils you move forwards or backwards, you increase the disc load by 10%. Okay? This was after a couple months with me. Look at the positioning of his spine now. You can see it's sitting exactly where it's supposed to be. His pain is gone. What do you think the likelihood of progression of his arthritic change is going to be? High or low? It's going to be lower because his body is not subject to as much loading. Okay? This was a lady who came in with headaches. Okay, so while you can see we haven't been able to fully correct the curve yet, this was after 3 months of treatment as well. Okay, so you can see she has abnormal curve. So in the neck, you should have a curve of 42 degrees. You can see when she came in, it was sitting at 5.7 degrees. She had lost 86% of the curve. And you can appreciate why there was so much degeneration. Okay, again, this is after couple months of treatment. We've managed to get it up to 28 degrees. She came in with headaches and neck pain. Headaches and neck pain are gone. She's moving a lot better, and you can see her spine is heading in the right direction. Okay, we are now obviously allowing her body to move better. She's not subject to as much loading, which you can appreciate is why she's not getting as many headaches. I just thought I would show you an MRI study of a herniation to show you that you don't have to have surgery. Okay. This was a 29-year-old female who came in with a severe herniation. Look at the size of that bulge compared to the other ones over there. She opted not to have surgery. This was a year after treatment. She had complete resorption of the disc. Okay, because again, the adjustments helped restore mobility and the traction helped position her in the right place. This was a gentleman who came in complaining of sciatica. This is early phases, so you're looking around like phase 1, phase 2 here. You can see big inequality. You can see how his spine is shifting to the side. This was after 2 months of care with Miss Aligned for Life. So again, look at the position of his spine and look where it is now. So again, we helped with his pain, but we've also prevented his spine from deteriorating further. Okay, do you want to see what would happen if you leave this over time? I'm going to show you. Okay, that's what happens. Why do you think this person's spine would degenerate like that? What do you think would cause that? It's just gravity. Look at the position of the spine. It's shifting to the side, out of its alignment. Gravity is going to keep pulling you down. It's not going to go anywhere. Okay, so this is someone who's obviously left that malpositioning for many, many years. You can see how the disc spaces are starting to narrow. You can see that this one is shifting across. You're starting to get a little bone spur formation. Okay, I thought I'd share a case study with you that was done with a gentleman who had an x-ray taken in 1993. He opted not to do anything. He came in for another x-ray in 2019. Look at how his spine has progressed over time. So you can see that obviously it was out of its normal alignment, an abnormal curve. That's how it should be positioned. This is where it was. So you can see how gravity impacted him over time. It brought his head further forward. You can see how the disc started to deteriorate. Okay, so intervening as soon as you can is the best thing that you can do. Looking after your spine, exercising is the most important thing you can do. Right, so how do you know if you have a subluxation? How do you know if that process of deterioration has already started? Well, you can use instruments. You can do motion palpation, where we run our fingers along your spine to see if the joints are moving properly. You can have a look at posture. Posture is really the gateway to what the spine is doing. The gold standard is an x-ray. It's the only true way you're going to see whether or not the spine is breaking down. Okay, so I just want to say thank you so much for coming this evening. I hope you found the presentation informative. Hopefully this gives you a little bit more information about what you can do and how to manage your problems. If you have any further questions, I'll be here for just 5 minutes. Otherwise, have a wonderful evening and thank you so much for your time.